Personal health records. Electronic personal health record. This is a private, secure application through which an individual or a client can access, manage, and share their health information. Unfortunately, paper is still one of the most common forms for medical records. The personal computer revolution began when desktop computers became affordable in the early 1980s, and it continues today with the increased adoption of various mobile devices. These mobile devices change how personal health records can be delivered and what they can offer for the consumer. The vision of the blue button, Download My Data, was that by clicking on the image of this button, the patient will be able to access their own records in either human readable or machine readable format. Mobile devices are changing how these health records will be delivered and what can be offered in these records. An ideal personal health record would facilitate improved coordination of care between providers. It would reduce repetitive testing, conflicting therapies, and improve patient safety. A function that allows users to assign a delegate or a proxy to access and control their records might also improve care that is delivered by informal caregivers. A system like a personal health record that is available and provides individuals with customized health promotion may improve the individual's self-management of their own care. The various systems of personal health records are determined by what they are linked to. It may be a standalone system that is linked to nothing. It may be a network system that is linked to all sources of data for the individual. A standalone record stores health information on an individual's own computer or a USB device. An untethered record is a web-based system that is separate from the health record. A tethered personal health record is linked to one clinic or healthcare system. A networked health record is proposed to address limitations of a tethered health record. In a network health record, individuals can integrate data from multiple sources, different providers, health plans, or labs. The data will then be integrated through the use of the access services that conduct user authentication before allowing the patient or the proxy to access the data. The Institute for Healthcare Improvement first developed goals to improve individuals' experience of care, quality of care, and the cost of this care. These were later adopted by the Centers for Medicaid and Medicare Services and are referred to as the Institute for Healthcare Improvement's triple aim for the care provided. Limitations of data are that experience is measured as satisfaction with care, quality is based on short-term outcome, and the cost is based on the utilization of the services. Most individuals are not aware of personal health records. Individuals that are below poverty level or poor and minorities are less likely to adopt their own personal health records. Approximately 2/3 of individuals say that they are concerned about their privacy of their health records. Both the personal and the electronic resources suffer from problems problems related to user capabilities. To address the problem of awareness, various government and non-government agencies have launched websites to help educate the public about their personal health records. Poor usability may hinder the adoption of personal health records. Older adults that have a lower literacy for health care were found to have a difficulty in using a personal health record to complete the management of their tasks. There is a digital divide that exists in the United States. Individuals of lower socioeconomic status, minorities, and those with low literacy, as well as older adults, have health disparities when it is related to electronics, computers, and using personal health records. Current personal health records are integrated with a limited number of systems and therefore only represent a little subset of data and services that an ideal personal health record should include. It is likely that a comprehensive ideal personal health record would be more attractive and would be adopted at a greater rate. The Federal Trade Commission estimates that 90% of Americans will have internet access by 2020, and that the adoption of mobile devices appears to be decreasing the digital divide. This also is decreasing the adoption and the usage of personal health records. However, it does remain limited, and 90% of Americans do not currently have internet access. The current records are not interoperable. In some states, there are laws that prevent full sharing of electronic health record data and prevent the practice of medicine across state lines. This would limit the use of personal health records for electronic visits. The current evidence is limited only to early adopters and the integrated healthcare systems. The data could be more comprehensive and integrated with a national health information exchange. Personal health records should be personalized and motivational to facilitate better health outcomes and behaviors.